My name is Dr. Mike Cissell. I'm an equine veterinarian that runs an all-dental practice called Mid-Atlantic Equine Dentistry in Aiken, South Carolina. So I've used quite a few different of the regenerative type therapies, from stem cells and PRP and things like that. I've also used amnion products in the past, both raw amnion for wound healing, superficial wound healing, and commercially available amnion products prior to using the Regenaflex. These days, most what I use it for, I've used it in the past for a variety of cases: superficial wounds, ocular injuries, tendons and ligaments. These days, being an all dental practice, I use it exclusively for sinus injuries and infected tooth sockets and fistulas. So the Regenaflex product, I use the membranes, and in my experience, I find that when I have an infected alveolus or a chronic fistula from a bad tooth, things like that, those can be really complicated cases as far as getting them to heal. And I find that the Regenaflex, when I use that membrane to pack the alveolus, it's almost always a one and done type treatment. It's done phenomenal in my patients. Some of these fistulas that I've treated are upwards of 5 to 6 years old, that they've been there. And the Regenaflex has just given me the ability to treat them and heal them rapidly, with minimal complications, and it's just made things a lot easier for me. So I've used amnion products before. I like the way that they work, the way that they stimulate granulation tissue. From a dental standpoint, things like fistulas can be pretty complicated and difficult to heal and frustrating. So a user-friendly product that I can keep on my truck, because it's an ambulatory practice that I can keep right there on my truck, and have stall side use of. It was kind of a no-brainer for me. It just fits right in the practice, and I knew that it would be able to do what I needed it to do as far as healing complicated injuries inside the mouth. I'm familiar with amnion and the science behind it. I spent a lot of time talking with the folks at Hilltop about their product in advance, as far as how they process the material, that kind of thing, and their control standards. So I felt extremely comfortable using the product. I mentioned that I've used some other products, amnion products on the market, and after talking with Hilltop, it was pretty clear that in my opinion, it's the absolute best one available. For me, I don't use it on every case, extraction case, but pretty much anytime I'm dealing with a chronic fistula in the mouth, I'm going to use it because I know it's going to get the job done quickly and extremely well. My client satisfaction with the way that it heals for the cost, it has been phenomenal. My clients appreciate it. I appreciate it. It's just, I can't recommend it enough. I think that's the great thing about the product. I wouldn't say I've had any hurdles. When I present it to my clients, they believe in it. I just haven't had a hurdle. I can't think of one. It's even on referral cases from other veterinarians, they've had an opportunity to see it, to introduce them to the product, and I have yet to have anybody not willing to try it. You know, it's an easy, convenient product, easy to use. Like it sits in my truck. I don't have to have special storage circumstances for it. I haven't had a hurdle.